Hi class, my name is Pamela and I will be reviewing different methods of improvement. First off, I must point out that there are two different areas that are going to be discussed, personal and systemic. If we were to refer to the case of Redonda Leanne Vaught and the Vanderbilt Hospital, they were both personal and systemic problems that led up to the death of her patient. To explore methods of improvement, I will be discussing both. As a nurse caring for patients, it is our responsibility to be the best care provider that we can be, and that means personal growth. We must be lifelong learners and remain up to date on changes in medications, treatments, procedures, and the technology that touches all aspects of nursing. We should go beyond the annual skills assessments provided by the hospital. We must be aware of any changes in policy and procedure and commit time and energy for further study in our chosen field. More education equals more awareness and reduction of the risk to our patients. Ownership refers to knowing all of the requirements of the job and being aware of the risk factors. Meaning, if the hospital creates an unsafe environment, it is every nurse's job to raise the alarm. As with the Shermed and Vaught's case, she has documentation from the hospital to use workarounds to receive the medication, but the nurses could have refused to work with the system until the safety concerns were addressed. If a nurse is unfamiliar with medication, treatment, or the specialty floor, he or she needs to ask for help. If a bedside nurse is overworked, tired, or stressed, it is important to ask for time off for recuperation. The nurse has a responsibility to know the limitations of themselves and the environment that they work in. If you see something, say something applies to our job too. Last but not least is self-reporting. If change is going to be made for better care and reduced risks for our patients, a nurse must report self-errors, a missed error, or a potential error they have observed. This allows issues to be identified and modifications in care can be made. Self-reporting could be made to manager, a charge nurse, or even anonymously.